Is it colic or a neurologic emergency? Your horse is restless, he looks uncomfortable. Perhaps he paws at the ground, stops eating, or simply seems unlike himself. Your first thought may be colic, but then he takes a step and stumbles. His hind legs appear weak, his face begins twitching, he seems unusually quiet, frightened, confused, or disconnected from his surroundings. Is this still colic, or are you watching the beginning of a neurologic emergency? Here's the most important answer. If your horse suddenly begins stumbling, losing coordination, showing unusual behavior, developing muscle tremors, struggling to swallow, leaning against walls, circling, pressing his head, or having difficulty remaining upright, call your veterinarian immediately. Do not wait to see whether he improves. Do not attempt to diagnose the disease yourself, and do not force an unsteady horse to walk. Some neurologic diseases can initially resemble abdominal pain, exhaustion, injury, or even behavior. West Nile virus and Eastern equine encephalitis, often called EEE, are two mosquito-borne diseases that every horse owner needs to understand. Both can attack the nervous system, both can become life-threatening, and both are diseases for which vaccination and mosquito control can provide important protection. This video will not teach you how to diagnose your horse. Only a veterinarian can do that. Instead, it will help you recognize the warning signs that could change the question from, could this be colic, to could this be a neurologic emergency? Let's begin with signs commonly associated with colic. A horse experiencing abdominal pain may paw, repeatedly look at its flank, stretch as if attempting to urinate, lie down and get back up, roll, sweat, lose interest in food, or pass less manure than usual. But colic is not one single disease. It is a broad term for abdominal pain, and its severity can range from relatively mild discomfort to a rapidly fatal intestinal emergency. That means suspected colic already justifies a prompt call to your veterinarian. Waiting for unmistakable symptoms can cost valuable time. The picture becomes even more urgent when the horse's movement, awareness, facial function, swallowing, or balance appears abnormal. Consider this simple 5-sign neurologic checklist. Number 1, sudden incoordination. The veterinary term is ataxia. An ataxic horse may stumble, drag, or cross hind limbs, sway while standing, misplace his feet, or move as though he is intoxicated. The hindquarters may appear especially weak. The horse may pivot awkwardly or nearly fall while trying to turn. These signs are not normal clumsiness, and they should never be dismissed as laziness or disobedience. Number 2, muscle twitching or tremors. Small involuntary movements may appear around the muzzle, face, neck, chest, shoulders, or trunk. In a horse with West Nile virus, muscle twitching can be a particularly important warning sign, especially when it occurs alongside weakness, fever, depression, or incoordination. A muscle twitch by itself does not prove that a horse has West Nile virus. Many different conditions can cause trembling or abnormal muscle activity. But new, unexplained twitching combined with any change in balance or behavior warrants immediate veterinary attention. Number 3, a dramatic behavioral or mental change. A neurologically affected horse may become profoundly depressed and appear unusually sleepy. Another may become hypersensitive, reactive, agitated, or frightened. The horse may seem unaware of familiar people or surroundings. He may wander, circle, stand in unusual positions, press his head against a wall, or fail to respond normally to sound and touch. Owners sometimes mistake these changes for stubbornness, panic, exhaustion, or pain. But when a normally sensible horse suddenly seems mentally altered, treat the change as medical, not behavioral. Number 4, facial, tongue, or swallowing abnormalities. Watch for a drooping lip, facial asymmetry, difficulty controlling the tongue, repeated teeth grinding, feet falling from the mouth, or difficulty swallowing. These signs may indicate that nerves controlling the face and throat are not functioning normally. A horse that cannot swallow safely may inhale feed, water, or saliva into the lungs. Do not try to drench the horse or force oral medication into its mouth, unless your veterinarian specifically instructs you to do so. Number 5, weakness that is becoming progressively worse. A horse may begin with a few uncertain steps and later lean against a fence or wall for support. He may struggle to rise, repeatedly buckle at the knees, or eventually become unable to stand. Once a horse goes down because of neurologic weakness, both the horse and the people around him face serious danger. A frightened, disoriented animal weighing half a ton can injure himself or a handler without intending to. If a horse appears unstable, prioritize safety, keep people, dogs, and other horses away. Remove hazards only if you can do so without placing yourself in danger. Call the veterinarian and follow the veterinarian's instructions about whether the horse should be moved. Do not conduct your own balance tests. Do not pull the horse's tail, force tight turns, back him repeatedly, or walk him over obstacles after watching someone perform a neurologic examination online. Those tests require professional judgment, a controlled environment, and an understanding of how severely the horse may be affected. An unstable horse can fall suddenly. So why can a neurologic illness look like colic? Pain is not the only reason a horse may paw, sweat, lie down, stop eating, grind his teeth, or appear distressed. A horse that feels weak, dizzy, hypersensitive, feverish, or unable to control his limbs may display some of the same outward behavior. A neurologic horse may repeatedly lie down because remaining upright is difficult. He may sweat because he is struggling to balance. He may stop eating because he cannot swallow properly or because inflammation affecting his nervous system has changed his behavior. Conversely, a horse with severe colic may also become weak, sweaty, depressed, or reluctant to move. There is no reliable home test that allows an owner to rule out either emergency. The safest response is to describe exactly what you see and allow your veterinarian to determine the next steps. You might say, my horse has stopped eating and is pawing, but he is also swaying behind and is crossing his legs. Or she has lain down twice. Her muzzle is twitching and she does not seem mentally normal. Those details may help the veterinarian recognize the situation involves more than possible abdominal discomfort. West Nile virus is transmitted primarily through a cycle involving mosquitoes and infected birds. A mosquito feeds on an infected bird and can then transmit the virus when it bites a horse. Horses are not believed to spread West Nile virus directly to other horses, and an infected horse does not ordinarily transmit it directly to a person. The mosquito is the crucial link in the usual transmission cycle. When illness develops, West Nile virus can damage the brain and spinal cord. Signs may include incoordination, hind-end weakness, muscle twitching, fever, depression, hyperactivity, difficulty swallowing, head pressing, excessive sweating, recumbency, paralysis, or death. There is no single outward sign that confirms the diagnosis, so veterinary examination and appropriate testing are essential. AAEP's West Nile guidance explains the transmission cycle, clinical signs, testing, and supportive treatment. EEE is also spread primarily by mosquitoes and can cause severe inflammation of the brain. Possible signs include fever, extreme depression, behavioral changes, impaired vision, circling, head pressing, muscle twitching, difficulty swallowing, paralysis, seizures, and death. EEE has historically been associated with particularly severe disease. A horse displaying neurologic signs should therefore be treated as an emergency, regardless of whether EEE, West Nile virus, trauma, toxicity, equine herpes virus, rabies, or another condition might ultimately be responsible. The owner's job is to not choose between the diagnoses. The owner's job is to recognize danger and summon professional help. The USDA advises owners who suspect equine encephalitis to contact a veterinarian, while veterinarians and animal health officials handle any required disease reporting. USDA guidance lists fever, depression, behavioral changes, head pressing, muscle twitching, swallowing, incoordination, and weakness, among other warning signs. While you wait for your veterinarian, observe from a safe distance and gather useful information, if you can, to do so safely. Note when the signs begin and whether they are progressing. Record the horse's recent travel, possible mosquito exposure, known vaccination dates, recent medications, injuries, changes in feed, and whether any other horses appear ill. If it is safe, take a short video of the horse standing or moving naturally. Do not make him perform for the camera. A brief recording may help the veterinarian see a sign that changes before arrival. Ask whether the horse should be isolated from other horses. West Nile virus and EEE are mosquito-borne and are not normally spread directly from horse to horse. But other neurologic diseases can have different transmission risks. Until a veterinarian evaluates the situation, use separate equipment, limit unnecessary contact, and follow professional biosecurity instructions. So what if you do not know your horse's vaccination history? Do not assume that one previous injection provided lifelong protection. Call your veterinarian and ask which core vaccines the horse needs, whether a new primary series should be started, how many doses are required, when boosters should be administered, and whether local mosquito activity justifies a different schedule. The American Association of Equine Practitioners classifies vaccinations against West Nile virus and Eastern and Western equine encephalitis as core protection for horses. Core vaccines are recommended broadly because the diseases pose serious risks and vaccination offers a favorable balance or benefit and safety. The correct schedule, however, depends on the horse's age, previous vaccination, health, pregnancy, status, geographic location, and product labeling. AAEP's vaccination guidelines should be applied through a veterinarian client-patient relationship, not used as a substitute for veterinary advice. Vaccination is one layer of protection. Mosquito control is another. Walk through your property and look for standing water. Check buckets, wheelbarrows, clogged gutters, old tires, tarps, plant containers, unused troughs, and depressions where water collects. Clean and fill water troughs regularly. Repair leaks, improve drainage where possible. Ask your veterinarian which equine-approved repellents are suitable for your horses. Fans can also reduce mosquito activity in some resting areas because mosquitoes are relatively weak flyers. Depending on locations, limiting exposures around peak mosquito activity may be useful, but mosquito behavior varies by species and region. Barn management should complement vaccination, not replace it. And remember that a beautifully maintained barn is not automatically a mosquito-free barn. A small amount of overlooked water may be enough to support mosquito breeding. The final message is simple. A horse that paws, rolls, stops eating, or repeatedly lies down may have colic, and colic can itself be an emergency. But when those signs are accompanied by stumbling, swaying, crossed limbs, hind-end weakness, muscle twitching, facial drooping, difficulty swallowing, head pressing, circling, seizures, and more, you must consider a neurologic crisis. Do not wait for every sign on the list. Do not wait until the horse falls. And do not let the fear of overreacting prevent you from making the call. You are not expected to diagnose West Nile virus, EEE, or any other neurologic disease at the barn. You are expected to recognize that sudden neurologic changes are abnormal. Protect yourself and others from an unstable horse and contact a veterinarian immediately. Because in an emergency, the most important question is not, can I name the disease? It is, did I recognize the danger soon enough to ask for help? Thank you so much for joining us. And remember, I am not AI. If you listen closely, you can hear me breathing. And we would also love your video suggestions.